Okay.
Yes, so I'm gonna record our session and welcome to this session and thank you for joining. Right. LERA best paper COVID-19 session. The COVID-19 pandemic has tremendously affected workers as well as organizations. So it's great to see studies that examines the role the pandemic has played on different aspects of employer relations and employee outcomes. In this session, we have a great combination of papers under the theme of COVID-19, which I'm excited about. So without further ado, I think I return to the first presenter, Abay, Asfaw.
Yeah, thank you. Do you see my screen?
Yes, perfect.
Okay. Good afternoon, and thank you for coming. My name is Abay Asfaw. I am from CDC NIOSH. And the title of my presentation is Racial Disparity in Potential Occupational Exposure to COVID-19. Studies have shown that, just to give you some motivation, studies have shown that COVID-19 disproportionately affected some racial and ethnic minority groups. And the literature identifies factors such as pre-existing health conditions as factors for the disparity. However, these factors alone may not adequately explain the current disparity in the infection rate. So the motivation for this study is why COVID-19 infection rates are higher among Black and Hispanic persons than among white and Asian persons. Occupation has been mentioned as one of the major risk factors for spreading diseases like influenza-like illness and COVID-19. For instance, very recently, Co indicated that, quote, COVID-19 is the first new occupational disease to be described in this decade, end quote. So the objective of this study is to examine if some racial minority groups were overrepresented in high COVID-19 exposure risk occupations relative to their share in the total workforce. So the working hypothesis is that Black and Hispanic workers were disproportionately employed in occupations with high potential risk of exposure to COVID-19. We used two data sources, the March and April current population survey and the ONET data, which is produced by BLS. Then we combined, we matched the two data sets. As you might know, the current population survey data have information on the number of workers employed in different occupations by race, white, Black, Asians, and Hispanic origin. We used the March and April data just to reflect the employment situation once the community transmission of COVID-19 had become established throughout the country. The BLS ONET data, as we shall see soon, have information on potential risk exposure, not only to COVID, to other diseases also, influenza-like illness whatsoever. So overall, we considered 83 three-digit level occupations in this study. Overrepresentation is defined as the representation of a racial or ethnic group in an occupation that exceeds the representation of the group in the total workforce. For instance, Hispanic workers represented around 18% of the total workforce. So if their share in the construction is 25%, then we say that they are overrepresented in that particular occupation. We use different ONET questions to estimate three types of potential risk of exposure to COVID-19. Exposure to disease and infection at work, we used one question. Inability to maintain physical distancing at work, we used two different questions. And inability to work at home, we used 5 questions. Fortunately, the BLS ONET provides standardized scores for each question, for each occupation, that ranges from 0 to 100. 0 means no risk at all, 100 is the highest risk. Let's start with the overall results. During March and April 2020, on the average, 120 million workers were employed in 83 three-digit occupations. So the first graph shows the share of different racial groups of the total workforce during the study period. For instance, white 79%, Hispanic, as I have said, 18%, etc. And the second graph shows the number of occupations in which different racial groups were overrepresented relative to their share in the total workforce. For instance, white workers were overrepresented in 47 occupations out of 83, blacks in 31, etc. But note that these are not mutually exclusive classification. I mean, two or more ethnic groups can be represented in one, overrepresented in one occupation. Let's start with exposure to disease and infection at work. As you know, workers in certain occupations are often exposed to infection or disease in their workplaces. So in this graph, we computed the mean score for potential exposure to disease and infection at work in occupation in which different racial and ethnic groups were over and underrepresented. So the overall average score for infection is 18 out of 100 for all occupations. However, as you can see in the last bars, in occupations where Black workers were overrepresented, the mean score were 26. And in occupations where they were underrepresented, the mean score was 15. This means that in occupation where Black workers were overrepresented, the mean score for potential risk of exposure to disease and infection at work was 79% higher than in occupations where they were underrepresented. And as you can see, the difference was statistically significant. For the other racial ethnic groups, the mean scores in occupations where they were overrepresented were lower than the mean scores where they were underrepresented. However, the differences were not statistically significant. The second risk factor we considered is inability to maintain physical distancing requirement at work. As you know, physical distancing is one of the key elements for avoiding or slowing down the spread of COVID-19, and for that matter, for other infection diseases. However, having the infrastructure necessary to maintain the required physical distancing varies significantly across different occupations. So the overall mean score for inability to maintain physical distancing at work was 36. This is out of 100. So again, as you can see in the last bars, in occupations where Black workers were overrepresented, the mean score for potential risk of inability to maintain physical distancing at work was 42, compared to 35 in occupations where they were underrepresented. So this was 19% higher than 19% higher, and it was statistically significant. For other racial groups, as you can see, the differences were not statistically significant. Finally, the final risk is inability to work from home. In response to COVID-19, some workers were able to perform their jobs remotely without major problems. The ability of workers to perform their jobs regularly at home varies by occupations. Jobs in some occupations cannot be performed remotely because it's practically impossible to perform the tasks at home, such as construction, meat processing, etc. So the figure represents the mean potential risk for inability to work at home scores in occupations where different racial and ethnic groups were over and underrepresented. So the overall mean score was 38 out of 100. In occupations where Asian workers were overrepresented, the mean score was 33% lower than in occupations where they were underrepresented. That means Asian workers were more likely to work at home. However, in occupations where Hispanic workers were overrepresented, the mean score was 69% higher in occupations where they were underrepresented, and the difference was statistically significant. That means Hispanic workers were more exposed to the potential risk of inability to work at home than any other racial groups. To see the validity of the ONET prediction on inability of some racial groups to telework, we compared the ONET mean inability to work at home score for different racial groups with the actual data from the current population survey. This is the ONET prediction. As you can see, the risk for Hispanic workers is very high, and the risk for Asian workers is very low. This is exactly what happened when you compute the data from March 2020 up to April 2021. As predicted by the ONET data, Hispanic workers were less likely to work at home. As you can see, it's only 40%, and Asian workers were more likely to work at home, 41%. This showed that despite its limitation, the ONET, the BLS ONET data can be used to predict occupational risks. To conclude, this study showed that Black and Hispanic workers disproportionately carried the highest potential burden of exposure to COVID-19 risk at work. Black workers were overrepresented in occupations with high risk of exposure to disease and infection and inability to maintain physical distancing. And Hispanic workers were overrepresented in occupations with high risk for inability to work at home. The results of this study might indicate that occupation can be just a risk factor for the disproportionate impact of COVID-19 on these minority groups. This knowledge can be useful in devising targeted prevention intervention in these high-risk occupations, including educational programs and vaccinations. And this intervention not only helped to reduce the spread of COVID-19, but its disproportionately high impact also on certain minority groups. The study has some limitations. First, we do not have information on different measures taken by employers and employees since the pandemic. For instance, because of the rise of online learning during the COVID-19 pandemic, the risk of infection for school teachers was relatively lower than teaching in person. Second, March and April 2020 current population survey data did not have information on race and ethnicity for around 10% of the total workforce. Finally, we used data aggregated at 3-digit occupations, as I have said before. This might camouflage disparities in the proportion of different racial groups employed in occupations with high potential risk of exposure, such as meat processing, nursing, occupational therapy, correction officers, etc. Thank you so much for your attention.
Thank you. It's very interesting finding. I'm just curious if you have any questions to Abay. Okay, so maybe we can turn to the second presentation, and if we have extra time, we can have a discussion at the end of the presentation as well. Right, so I will turn to Lifei and Dr. Christine Riordan. Title is People or Market, an empirical examination of responses to the COVID-19 crisis among large US firms.
Okay, I will share my screen with you. Can everyone see my screen?
Yes.
Great. Hi, everyone. My name is Lifei Chen from University of Illinois at Urbana-Champaign, and I'm here to present our paper, People or Market, an empirical examination of responses to the COVID-19 crisis among large US companies. So I will go through our research question, theory, and findings. So without further ado, let me start from the background and research questions. As we all know and are currently still influenced by the COVID-19 pandemic, which influenced the United States from March 2020, the US federal government response to COVID-19 is not enough and almost muted. So the cases were skyrocketing back then. Given such threat, some of the country's largest corporations had announced various responses to the pandemic regarding the work arrangements, employees' health and safety. As firm responses range widely in different sectors and industry, we are interested to see to what extent is there variation in firm responses and what accounts for this variation. Our model and hypothesis are built upon a theoretical framework from Sakura and Osiewski and model of crisis response. They propose that the origin and nature of the crisis are key to understanding the firm responses to the crisis. In their framework, there are two types of theory or crisis origin, one caused by economic or technological reasons, such as 2008 financial crisis, and the firm will need market-based response, such as adjustment to prices or output. Another one caused by humans, such as terrorism or environmental disasters, which requires firms to respond by changing organizational plans, policies, or practices which target human interactions. The nature of the crisis in the framework is to predict the overall orientation to firms' response. Given the fact that the COVID-19 is a human origin crisis, but also quickly evolved into a public health and economic crisis, firms are most likely to incorporate both market and human-oriented responses. In such case, as described in the theoretical framework, organizations will orient their response actions to whichever is more salient, the economic or human side of the crisis. So to answer our question, we use the data from Just Capital, which is a nonprofit organization primarily collecting data that access US companies' behavior in different dimensions and rank the companies. And they also track the firm's response to COVID-19 from March the 25th, and we use the data set in the date from March 25th to June the 9th with 20 different response items. The item and distributions are shown in figure 1. So we combine the ranking and as well as the COVID-19 response data set from the Just Capital with a total of 279 largest company in the United States. So in our first hypothesis, we think that the firm's responses were bifurcated into market and people-oriented categories as described in the theoretical framework. So we conducted a factor analysis, and as we can see here from the result table, market-oriented responses, which included items such as furloughs or closing stores, addressed the economic impact of the pandemic. And people-oriented responses, which included items such as paid sick leave and customer accommodations, address the health or human impact of the pandemic. So now we know that there are two categories of responses in firm. So we'd like to see, as directed by the literature, how the two origin of crisis, economic versus human, predict companies' choices of strategy. So we propose that in our second set of hypotheses, orientations can be predicted by the severity of either health threat, which is represented here by number of COVID cases, or economic threat, which is represented by mandate order stay-at-home policy. So put together, we hypothesize increasing COVID-19 cases in firms' headquarters state while positively associated with people-oriented response, while state mandate stay-at-home order were associated with market-oriented response. Well, we all know that industry make a huge differences during the pandemic, whether you can operate or you're classified as essential companies makes a huge difference due to the pandemic's nature and also the mandate and other restrictions. So we classify the companies into 3 different categories: essential, face-to-face, and remote. In our hypothesis 3, we propose that those firms with face-to-face service, such as restaurants, are more likely to engage in market-oriented responses, while firms with remote and essential jobs, such as pharmacy and technology firms, are more likely to respond with people-oriented strategies. To answer our research question, we use multivariate regression analysis to test these hypotheses. The full analysis model includes the presence or absence of a stay-at-home order in the firm's headquarters state, which is taken from the CDC, and average COVID-19 cases in a firm's headquarters state taken from the Johns Hopkins COVID tracker, and the nature of job at the firm, which is classified into essential, face-to-face, and remote. And firm resources, which is represented by total assets and the extent to which the firm focuses on long-term profits versus short-term gains, and the company's degree of ownership concentration. We also used a couple of control variables, which include the firm's political dynamic, age, and firm's region. So we find support for the hypothesis to be, as we can see here from the regression table, that firm facing stay-at-home mandates are much more likely to pursue market responses. Continuing on our hypothesis 3, we can see that nature of job matters. The hypothesis 3A is supported and B is partially supported, with the effect of the job nature most strongly for market-oriented responses and firm with face-to-face jobs. So the takeaway for the paper is that we find the firm response to COVID-19 bifurcated into 2 types of responses, market or people-oriented. So in the other 2 sets of hypotheses, we find that market orientation can be predicted by the same mandate, stay-at-home order, also the nature of job matters in predicting firm's response as well. Besides, we also tested for interactions in our regression, and we found that the COVID-19 cases and stay-at-home mandates are moderators for the market-oriented responses in face-to-face firms. We also find underlying characteristics of firm matters in a crisis. They possibly associated with people-oriented responses. Those organizational characteristics included greater resources, centralized ownership, and longer-term strategic outlook. That's all for my presentation. Any questions?
It's great. So I think we can turn to the next presentation and we can discuss maybe at the end of the session. Right. Thank you. Thank you so much for your presentation. It's great. Now let's turn to our 3rd presentation, which is about how COVID-19 has shifted retailers' technological trajectory and resulting impacts on job quality, by Drs. Carr and Tilly.
So I'm going to start and then Françoise will finish up. And let me just, so the title has evolved and the concept of the paper has evolved, but COVID-19 and technology are still in there. So, well, by this time, it's a familiar finding that retail jobs are bad jobs, having gotten worse over a period of decades. It's true in terms of compensation, scheduling, and other dimensions of job quality. At this point, there's a rapid shift to digital technologies within retail. And this offers a choice point, both in terms of technological adoption, but also a choice point in terms of job quality. We are focusing on store-based retail because that's still the great bulk of people in retail, despite the growth of e-commerce. And we point to both what you could call push and pull factors in leading to the shift towards digitization. Push in the sense of competition from online retailers, and pull in the sense of these technologies becoming more affordable, and also a very targeted marketing push by a lot of tech providers. There's then these two open questions, one about technology and one about job quality. Even in the presence of digital technology, there's always a choice about whether to solve problems and carry out tasks using digital technologies or human ones. And in the last few weeks, there's been some attention-grabbing shifts by Walmart. One was that they purchased hundreds of Bossa Nova robots to scan for gaps in shelves, but then ended up scrapping the robots. Their public explanation was, we have so many people out there fulfilling orders, they're spotting the gaps on shelves, we need robots. They also were using pickup towers or kiosks and decided they wanted to go to a curbside handoff exclusively instead. This connects to some broader questions about path dependency and how viable the high road is. We're not really going to touch on these in this paper, but it's certainly part of our agenda. I have to say, this is not really a COVID paper, so maybe it doesn't really belong in this panel. But I mean, certainly we are attentive to what's happened with COVID. And there's both transitory effects in terms of the risks that Abay was talking about, and also friction up to the point of retail workers getting killed over asking customers to wear masks. There was what we would describe now as a brief moment of the public viewing retail workers as heroes, which at this point has pretty much passed. But in the longer term, there are some important impacts here, both a sort of divergence between the essential retailers who've seen profits increase and have been able to invest, and the non-essential retailers who've been hammered financially, and acceleration of the digital transformation heightened by the COVID situation. What this paper is based on is new field work since the report we put out in 2020 on technological change. The biggest chunk of this has been micro interviews that have resulted from conferences going virtual into a meetup format where you literally schedule 15 or 20-minute meetings with dozens of people. And that's what we've done. Just to summarize the four areas that Françoise is going to speak to, they are digital surveillance and direction, a set of new tasks that bring with them at least the potential for new stresses, further fragmentation of already fragmented schedules, and the growth of, at least to some extent, of gig work within retail. So what we're pointing to then is new margins of degradation, and I will hand it over to Françoise to talk about them.
Okay, thanks. So moving ahead with the second half of our talk, the categories, the range of digital technologies we've looked at, and the functional areas of retail store work that we've looked at, the jobs have been impacted, and the technologies have been used in what we think are three different ways, or three different goals. One is optimization of the use of labor, meaning both deploying workers only when they are needed in the store, and then using them fully when they are in the store by multitasking and other things. So that's optimization. The other one is automation, and that's the more obvious one that we'll think about when we think about technology. And the third is increasing what's called effectiveness of, I put my phone on mute and it didn't work. Increase effectiveness of labor, essentially enabling workers to have better access to information about products that they're selling, as well as about customers with whom they're interacting. So on the first dimension of this and function of and use of technology we're thinking about is digital surveillance and task direction. There is at this point extensive monitoring going on. Some of it is what we call active monitoring, where workers are aware of cameras on ceilings and on shelves, and They are required to document with their cell phone how when they've completed and how they've completed a particular display, for example, or whatever cleanup task they had to do on a produce shelf. There are also motion and posture sensors that are sometimes used in stores. All of this is sort of the worker can be aware of because they're doing it themselves, or if they're not aware of it because it happens at the same time as us, the customers, are also being monitored in stores. And then there's another kind of more passive monitoring, which is essentially collecting data at the point of sales around patterns and productivity, those kinds of things. And what is probably more recent in all of this is not only the sort of the array of digital tools, some of which are enabled by artificial intelligence, but it's also that it's all undergirded by greatly enhanced data collection and retrieval capabilities that are more powerful, more affordable. And the question we have, and we're still not entirely sure, is how widespread the capacity to actually analyze that information is across store-based retail. We know that they are getting standardized products from the tech providers in terms of basic analytics, which might drive even the way they think about how their operation works. But we're not aware yet, or not sure yet, because this is still preliminary work about the extent to which retailers actually make use of that data. The second thing is basically we see new tasks and new threats and new stresses for workers in stores. The two examples we have, and they're kind of quite prominent and visible. One is self-checkout. And the job has become overseeing self-checkout. That self-checkout had been tried and has been used sparingly and off again, on again for years. But the pandemic has actually accelerated the rollout and use of self-checkout, either because the customers want it or because it's a lot cheaper now and they can get us to accept it. And really, so that's one bundle of changes. The other one is around what we're all aware of, which is online order fulfillment, which can be done manually in stores. And that takes a lot of labor. And you see it when you go in a supermarket in particular. But it also now includes micro fulfillment centers that are automated centers that will take care of a piece of the order fulfillment. The outcomes for workers or the impacts on workers are really going to depend on the staffing level in stores. Whether these changes are seen and used as ways to just basically cut back on the labor hour budget, which is a standard and long-term practice of retailers that are watching their profit margins, or are staffing levels adequate? And the evidence we have so far is from earlier implementations of self-checkout, was that the job is actually difficult and stressful because there's one worker for 5 kiosks, and their job is entirely to deal with things that don't work in the kiosk, either because the customer is not paying attention and irritated, or because there's something wrong with the software. And on the store fulfillment of online orders, indications, and I would stress the word indication at this point, are that that work is also understaffed, so that there are increases in workload. And there's an article today in the New York Times where the journalist interviewed workers reporting that kind of thing as well. Third thing we see is a further fragmentation of schedule. Now that's not new. Unpredictable and highly variable schedules have become quite standard in large retailers. What's now available and being adopted in some places is sort of the ability to forecast demand, use AI, handle data, and schedule in 15-minute increments, schedules in 15-minute intervals. And that's what a company called Reflexis and other similar ones have offered. In this particular case, they've offered it to AutoZone stores. A fourth issue is, Chris already alluded to it, which is employment fishing or gig work comes to retail in force. Now, there's been a long-standing pattern in retail to fisher employment basically around full-time versus part-time, and then fishering part-time between steady part-time and very short hours, highly fluctuating schedule part-time. So that's a kind of fishering that the industry has relied upon since the 1970s. This is a little different. It's using essentially those gig work arrangements. So the ones that we considered old news, though they're still rather recent in terms of the intensity of use, are the Instacarts of the world and the Shipt, a company that Target owns and uses, where people come in stores and are paid per shipment that they've called together and then driven. But probably a newer and kind of in some ways more worrisome types of practices are companies emerging, and they, digital companies emerging around organizing gig work platforms, to provide workers on demand, essentially making the argument that it will solve the problem of store managers that have to put together, patch together schedules on short notice, and they're able to sort of crowdsource workers and deploy them for generic retail tasks. And so the name of some of the companies are Drives and Work. The second pattern is also crowdsourcing, but that are for platforms that are arguing and advertising that they can do much more specialized work. And what they mean by specialized is actually doing a narrow slice of retail work. So in the case of Trax, they contend that they can crowdsource up to 1.4 million workers, to go and stock store shelves competently and accurately. And they do some monitoring of the quality of what's done. And then there are other companies like Observer that are doing this more module-like work. For example, working for consumer product companies and crowdsourcing workers, sending them with their cell phones in stores to record whether the product is displayed properly, whether the product is displayed at all. And what the workers do is that they actually compete online for a so-called opportunity, and they have anywhere from 2 hours to 5 hours. In the pandemic, it's 5 hours to complete their task. And then they get extra bonuses if they manage to talk to a manager and get the manager to order a product on whose behalf they're doing the research. And if they get the manager to order the product and start carrying that product, then they get extra pay. So a lot of things to worry about. The Retail Industry Association, one of the Retail Industry Association is actually touting the model of gig work because it would enable retailers to do what they need to do without getting in trouble with regulations around employment. So again, the findings are preliminary. We don't have a whole long timeline yet, and they're likely to be somewhat distinctive trajectories for different types of retailers, but that's what we have so far. I should say also that early on, we talked about how there's some technologies that can be used to render work, to make the work more effective. And we have questions about those types of practices too. In other words, is it good for a worker to have access to more information and possibly on-demand training? Possibly yes. But if it also comes with ratcheted expectations in terms of multitasking and added workload, it may not be so good to workers. The policy issues we see are first, probably the one that's most salient for us is a privacy policy for workers. Right now, most of the discussion is about customers in stores and whether they're tracked and how they're tracked and what's done with their data. A second big area is that there will be displaced workers. There won't just be new jobs, there will be displaced workers. And the question is really, how do you build support for policies around supporting and aiding displaced workers in an industry that is accustomed to having very, very high rate of worker turnover. So it doesn't think of its workforce necessarily as a steady pool of workers that may need to be helped through transition. Thirdly, and that's probably the issue people know more about or hear more about, is the question, of course, of the legal status and the employment categorization of the workers that are going to be crowdsourced. And finally, another obvious one is the need for increasing shoring up workers' access to voice in the workplace. Thank you.
Thank you. It's great work. Right. So now I turn things over to the last one. You can start to roll with the punches, Parenting Adaptability and COVID-19 by Rebecca and Jeff.
Great, thank you so much. So I'm going to start off the first half of the presentation, and then Rebecca will finish us off in the last half. So this is the title of our paper. You can start to roll with the punches, Working Parents, Adaptability, and COVID-19. So just, you can go to the next slide. Just a quick overview. So I'm going to talk a little bit about our background literature and our methods, and then Rebecca will go over our findings and some of our concluding thoughts and questions. So for this paper and this analysis, we really, and you can go to the next slide, we really grounded our analysis in this concept of psychological flexibility. So we use this literature on psychological flexibility to develop and think through what our data was showing. So just like a little bit more about what psychological flexibility is. As you can see on the slide here, it refers to the ability of an individual to accept aversive emotional experiences in the moment while maintaining engagement and value-based behaviors. And so what we're really thinking about is how we wanted to kind of expand this concept and think about it sort of beyond the individual and thinking about it really as a social phenomenon, and how flexibility sort of with emotions and with particular experiences and stressors, in this case, COVID-19, how this impacts interactions with the family and children and your immediate community. And so digging sort of more into the literature, we kind of started to notice there's kind of feedback loop, this cycle happening where some research found that parents with low psychological flexibility tended to struggle more with COVID-related stress specifically, and they tend to experience greater family discord and reach for harsher, more authoritative parenting tools. And then other literature saw that, unsurprisingly, this kind of greater COVID stress that might have been brought on by a variety of things leads to higher parental stress, and then greater parental stress is associated with lower psychological flexibility. So we can kind of see the importance that sort of adaptation and flexibility is when encountering stressors during this pandemic. So for this, this is a qualitative analysis. So we really had we did sort of a point in time kind of analysis, because we did interviews. We started doing interviews in the fall of 2019 through the spring of 2020. And we had stopped in the early spring when COVID happened, but then started doing these follow-up interviews in the later spring. So from April 2020 to July 2020, we followed up with the participants we'd interviewed in the fall, and kind of were asking them more about sort of how COVID had impacted their work and their parenting as well. So we ended up interviewing 6 participants for the re-interview within our sort of 15 total sample size that we had done the initial interviews with in the fall of 2018. So this is where we kind of got from our title. This is the excerpt that we got that quote from. And this just, we felt like really kind of encapsulated this, the concept that we're kind of working on, which is taking, again, psychological flexibility and expanding it, looking at parents, right? So parental flexibility is kind of what we're working with here. So, in this quote here, the participant says, you kind of get used to it, you can start to roll with the punches. I guess that's what being a parent is all about, rolling with the punches and learning how to adapt and overcome. And, I mean, do I think it could be done better? Absolutely. Am I going to yell about it? Not anymore. So you can really see that kind of, for lack of a better word, the rolling with the punches, the really adaptation that's happening, recognizing things can be done better or differently, but just kind of having to go with the flow and kind of adapt on the fly. So what we want to kind of point to today is, in our interviews, we had some areas where flexibility really kind of emerged, and sort of how parents were adapting and being flexible in particular contexts. And again, these interviews that were specific at the beginning of COVID. So we saw some flexibility around sort of the burden of homeschooling as more schools shut down and children were at home. This idea of multiple household complexity. So when, if there are parents across multiple households, or, or with built-in childcare with family, like extended family, different households, how that was kind of navigated. And then it also came up in the context of managing mental health, both managing mental health of family members as well as the parents. So I will turn it over to Rebecca to go over those findings.
Awesome, thank you, Jeff. Yeah, as he was saying, one of the first kind of areas that we saw a significant need for parents and family units, kind of by extension to practice adaptability under these circumstances, was the added burden of homeschooling. And one of our participants said, I'm the one trying to teach him as much as I can. I mean, I'm not a teacher at all, you know, I have no idea how to teach. I don't know the things that teachers teach. I have no idea. I have all the respect for them. And this was a common refrain across our participants, really trying to adapt to a really sudden role as teacher, most of them without any educational training. And a lot of them were really feeling kind of lost in this sudden switch. And they talked about their kids feeling kind of lost in this sudden switch as well. And our sample is entirely working parents. From the retail and service sectors. So a lot of them were also struggling with working around schedules and that sort of thing, and trying to homeschool their children simultaneously. Multiple households was also something that a lot of different participants were navigating. So for parents who may not live with their children's other parents, or if they have, you know, built-in childcare, maybe grandma and grandpa are really involved in raising the kids. It was definitely an added level of complexity. One participant was saying, at first her mother and my ex-mother-in-law were allowing friends to come over. And I'm like, dude, what are you doing? They just completely go against everything that they're dictating right now. And at that point, you had no idea because everything was so new. You had no idea what was going on. You had no idea who would be greatly affected or whatever. I'm sitting here thinking to myself, you're opening yourself up to a big can of worms here, you know? So in a pandemic situation where you've got different ideas about what risk is, how that should be managed, and you're going across multiple households, we saw a lot of need to adapt to new ways of working around schedules and navigating multiple households. In that sense, because very often both parents were working, so they needed to kind of arrange childcare across multiple households, and then also new ways of communicating and establishing rules and boundaries in ways that it hadn't been necessary before. Built-in childcare also came up a lot. Several participants mentioned using family members as childcare, often grandparents. Kind of recognizing the risks of that and doing their best to mitigate them for these working parents, accepting that that risk was kind of the only way that they could do things was a pretty common experience. One participant said, well, our kids, my parents will come over and help them out. It's super bad that we're kind of doing this because we're not supposed to be mixing. Like I was told by my friends, mixing the older generation with the newer generation because COVID is more infectious to or more dangerous to older people than younger people. So not only should they not be traveling, but they shouldn't be mixing with our kids, you know? But that's the only way we can do it. Under schedule crunches and income crunches, and with a ton of new changes, we saw a lot of parents needing to be really flexible in how they were navigating those kinds of boundaries and making those decisions around risk and exposure. And also managing mental health. Both parents and kids that we talked to were finding that they were struggling with mental health, as I think probably all of us did at some point during the pandemic. In general, parents were kind of reporting feelings of overwhelm and like a feeling of chaos as they were navigating new stressors and also navigating being a parent, and also the kind of exposure at work that they were then bringing home was a mental health concern for a lot of parents. And also while dealing with all of this, there was a disruption in formal care and healthcare accessibility, particularly at the beginning of the pandemic when systems hadn't totally adapted to this new way of doing things yet. And that is when we were interviewing folks. So we had one of our participants say, it's been really hard trying to manage everything just because I don't know where to go for help anymore because I feel like everything's so closed and I can't even get in contact when I'm on the phone. Everybody's calling and doing stuff now. I really want to get seen by someone, get help, talk to someone just that I feel like I don't feel like I'm having to fix it myself, especially when my kids are here. I feel like I don't have time to be down. So in addition to all of this, also the burden that a lot of parents were feeling to keep up their spirits and really do their best for their kids in such close quarters. So some of our conclusions here, just kind of looking at parental flexibility, this kind of broadening of the idea of psychological flexibility to be more reflective of its context in the family unit, being pretty key among our participants to more positive early COVID-19 experiences. And we really kind of landed on this term thinking about how psychological flexibility can be demonstrated and what it looks like in this particular context of a high stress environment. So looking at its manifestation, not just in the individual, but across the family unit. And yeah, that is what we've got. And if anyone has questions, we're here.
Yeah, I think Tilly has some questions about your presentation. So there has been much attention to gender differences in who's getting stuck with care work. So any observations on gender differences? Tilly, if you want, you can add more comments.
Yeah, we did see that a bit. We have a pretty small sample size for this qualitative portion of our work. So this is part of the SHIFT project work with Daniel Schneider and Kristen Harknett. And so our qualitative portion is smaller. In our quantitative portions of the project work, we've definitely seen that on a larger, more demonstrable scale, even though anecdotally among folks, we were seeing that a lot of mothers that we spoke to were feeling more stressed than fathers were. And we saw a lot more conversation from fathers about specifically the work side of managing this, and more on the childcare side of managing both duties from mothers.
Got it. I actually have a follow-up question. I might have missed it, but could you give me more information about the sample interviewers you've talked with? Because I felt like maybe they might feel very differently depending on SES, their maybe technological access differences. So some people might have a relative deprivation depending on their background. So I just went curious about interviewers, if you give me more information.
Yeah, the interviewers, people doing the interviews.
Yes.
Yeah, so I was an interviewer for this. Jeff was also an interviewer.
Oh, sorry, interviewees. Sorry about
that. Got it. Yeah, so our sample is from the Bay Area, and folks who are working in the retail and service sector. So that's what is really consistent across these participants. Some variation in SES, but since folks are working in these jobs, relatively consistent, lower income folks. So
it makes sense. Yeah. Okay, thank you.
And all who had who were still working, these were all people who wanted to make sure who still were holding their jobs during.
Yeah, thank you. And I think I have a question to Lifei. So Tilly had a questions. Do you have any interpretations of the impact of longer strategic view on people-oriented responses?
I was going to jump in on this because I recently came across a couple of papers that were talking about kind of looking at similar categories of responses. One was based in the US and the other was based in multiple emerging markets. And they were basically finding that these kinds of policies that we label people-oriented policies, they were measuring them against firm performance. So performance in the stock market, performance with shareholders. And there are a couple of emerging pieces of evidence that firms that are using or employing people-oriented responses perform better. The kind of thought behind it, or the theoretical thought around it, is that it's because firms are oriented around stakeholders. And so that kind of stakeholder prioritization is valued or is thought to be valued in the stock market. It's thought to be valued in the media. And so there's some positive relationship there. We've actually been, so the Just Capital data we have has stakeholder rankings. They collect data on workers, communities, investors, owners. And so we actually started looking for some evidence of this in the data, and we didn't actually find anything quite yet. But we are hopefully very soon getting the organization expanded their pool to around 1,000 firms. And so we're going to take another look at that. We're also trying to take a look at specific worker pieces of data around health and safety, enforcement violations, those kinds of things, and to see if there's some kind of relationship there, if we can kind of put more meat on the bone, so to speak, in terms of the stakeholder argument. So some evidence that the evidence that we see so far is what I've seen anyways, is really based on financial performance, but suggests that it's positive.
Okay, thank you. I have a question to Abay. So what do you think what would be the next step in analysis? Repeating study with the post-vaccination information or any information on earning impact of the loss due to COVID-related sick days?
Yeah, thank you. Actually, our follow-up studies that have said this ONIT data was collected just pre-COVID. So after COVID, so many things have been changing, and then there are a lot of protection. Physical distancing is implemented in different occupations. So we want to see the post-COVID-19 exposure risk of workers, and also if there is also still there is racial disparity in exposure. And we have also a follow-up study on disparities in different income groups. So we have also that type of follow-up studies. Thank you.
Okay, thank you. And I have a question to Chris. For the changes you identified in your study, do you feel all of them would be transformational shift, or are they just a fashion implementation? And do managers have a sense of what would be there for long haul? Would this difference affect the nature of the job differently? I ask a lot of questions at the same time, but you can answer.
Well, let me try to keep it brief so that Françoise can also weigh in. Well, these are our research questions, and we're still in the middle of the research. But I would say that, I mean, and we may actually disagree on which we think are most likely to stick. For me, the surveillance, digital surveillance and direction, I feel like those are genies that are out of the bottle. And given that these technologies are available, I think there is going to be a major shift there. But we'll see. Françoise?
Yes, I think that those questions are exactly the questions we have as well. But I mean, there are some things, highly expensive, very automated solutions are still very much in question. And that's why Chris gave the example of Bossa Nova robots in the Walmarts, an entire rollout that was publicly announced that was then canceled. It resulted in Bossa Nova laying off half of its staff in one day when the decision was made. So definitely there's a lot of uncertainty around that, but there's not a lot of uncertainty around the accrual of data for surveillance of workers, for surveillance of customers. There's an awful lot of pilots. There's an awful lot of CEOs on public stages touting particular examples. I think that, not to be inventive at all, that self-checkout is going to remain. It's something that has had a very low rate of acceptance by customers and is now almost, it's like mandatory in most CVS stores, for example, almost mandatory. It's very hard to get a worker to actually cash you up. And so things like that are going to be possible. The other ones are the ones that made the work inside the store a lot easier for managers. So the temperature sensors on coolers, for example, those kinds of things. Any equipment that helps track gaps on shelves is likely to be acceptable and accepted, and the simple versions are affordable. The really good versions are quite expensive. And those will have consequences for workers because they'll prompt workers to restock continually instead of doing it on a regular schedule, for example. So that's what I can say for now, given that we're reaching the end of our time. But we're happy to talk more offline.
Great, thank you. I think the time's almost up. So thank you so much for the great work and best of luck on your project, and hope to see you around.
Okay. Thank you.
Thank you.
Thank you.
Thanks.